It has been just over 1 year since the government announced its commitment to health system transformation in Manitoba, including the formation of Shared Health. Past expert studies and reports have concluded the way Manitoba's health system is organized is an impediment to effectively delivering health services to patients. There is a strong system-wide understanding of the need for strategic change and the need for improved quality of care and sustainability of health services across Manitoba. With a population of 1.3 million, Manitoba's health system delivers services through more than 200 organizations. In other jurisdictions, that population in a concentrated area would be served by a single tertiary care hospital. Our health system has a staff of 55,000 people, a budget of more than $6 billion, and a complex organization of employers and unions with 183 different bargaining units. Each of the 200-plus organizations plan and deliver healthcare services in relative isolation of one another. While each organization celebrates success in certain areas, the absence of a provincial approach has led to uncoordinated service delivery, duplicate services in some areas, and limited access for patients in others. In addition, we see poor outcomes and national rankings across a number of categories and increasing costs system-wide. Numerous studies have identified our system as being overly complex. This complexity, they conclude, both affects how care is accessed and delivered and increases costs. Other jurisdictions have tackled these problems ahead of Manitoba. In comparison to jurisdictions such as Ontario and British Columbia, where increases to health service budgets have been managed, Manitoba's health services costs have grown at 5.8% per year, significantly more than our province's 0.8% population growth. If Manitoba were to ignore that progress made by other jurisdictions and not manage the rate at which the health budget increases, the annual health care costs of $6.2 billion today would increase to $13 billion within 6 years. Our province's population simply would not be able to sustain such growth. We know that we have very skilled healthcare providers and support staff in Manitoba. And we know there are some areas where Manitoba performs quite well as compared to other provinces. You can see from the most recent CIHI statistics that Manitoba ranks between number 1 and number 3 in many categories. However, despite the second highest per capita health spending in the country, Manitoba struggles with poor health outcomes in a number of categories. Manitoba ranks last among provinces for inpatient length of stay, cataract surgery within 112 days, emergency department wait time for physician initial assessment, and total time spent in the emergency department for admitted patients. One of the main goals of health system transformation is to improve these health outcomes for Manitoba and to achieve national benchmarks. The diagram comes from the Virgo report regarding mental health and addiction services. It represents what a patient must navigate to access mental health or addiction services in Manitoba. Health system transformation will provide the opportunity to make the pathways and navigation for patients more clear and less complex. These maps, while not intended to be illustrative of an exhaustive list of services available in our province, provide an idea of the types and access points for services across the province. You will note that as you look at the various categories of service, access doesn't appear to be the issue. In Manitoba, the issue is integration of services. Health system transformation gives us the opportunity to broadly assess our system for what is working and could or should be extended province-wide. Assessment will also determine where services are not effective, need improvement, or are not evidence-based. In such cases, prioritization will occur to determine where resources may be redirected to areas of greatest need. This diagram shows Manitoba's current healthcare system. With 8 independent health delivery organizations, each planning health services in relative isolation from one another, duplicate services, inefficient service delivery, and inconsistent or inequitable access to services throughout the province have been a reality for Manitobans. This diagram shows the health system as of March 2018. The health department is in green, the regional health authorities are in the darker blue, and provincial organizations are in a lighter blue. The first step in this strategic realignment was the establishment of Shared Health on April 1st, 2018. The central mandate of Shared Health is to establish provincial clinical governance and lead the development of a provincial clinical and preventive services plan. There are also opportunities to bring together key functions from across the system into Shared Health, such as provincial workforce planning and central bargaining, and certain support and administrative services, such as supply chain management, information and communications technology, and payroll and benefits. The creation of these shared services does not necessarily mean the centralization of these services. Centralization may or may not be part of the shared service and will be determined as the plans are completed. The move to a shared service model is motivated by the opportunities it presents to perform more efficiently, freeing up resources to be reinvested in clinical and preventive services. In addition to the establishment of certain shared services, some facilities and provincial services will transition to Shared Health. These are facilities with a provincial scope, like the Addictions Foundation of Manitoba and Health Sciences Centre Winnipeg, as well as provincial services such as ambulances and patient transport, also known as emergency medical services. A central goal of transformation is to strengthen the commissioning role of Manitoba Health, Seniors, and Active Living. It is likely that some resources in the areas of performance and accountability management, as well as information management and analytics, will move from the regional health authorities and Cancer Care Manitoba to the department. In the end, Manitoba will have a realigned system made up of regional health authorities and Cancer Care Manitoba, focused on service delivery, Shared Health coordinating provincial planning and delivering provincial shared services in a more effective and efficient way, and a health department with a stronger accountability framework. So, how does this blueprint go from paper to action, and what does it mean for staff within our health system? This slide shows the various projects that have been or will be initiated and implemented over the next 3 years. Staff affected by the different projects will be provided information about how the changes will affect them. As you can see, many projects are occurring at the same time across all health organizations. Organizations have been busy working on transformative changes, and staff from across the system have been invited to participate in the projects by an expression of interest process. For the Clinical and Preventive Services workstream, a clinical governance structure has been established for clinical and preventive services planning and implementation. Provincial clinical teams will be co-chaired by a University of Manitoba medical lead and a clinician from either a rural or northern community. These teams will be made up of medical specialists and family medicine practitioners, Indigenous health experts, and nurses. They will also have advisory input from allied health practitioners, emergency medical service providers, and other functions listed on the left-hand side. These teams will develop provincial clinical and/or preventive plans based on population need. An integrated leadership team made up of the leads from the provincial clinical teams and other services such as quality and patient safety will ensure that the individual clinical and preventive service plans across the continuum of care are integrated. An overall integrated plan is expected to be complete by the spring of 2019. There have been a number of transformative changes occurring within the Winnipeg Regional Health Authority over the past year. The region has realized good early outcomes with the transition of the Victoria Emergency Department to an urgent care centre in October 2017. Between October 3rd and April 30th, wait times decreased by 29%, although the number of patient scenes was 26% higher than what was experienced at Misericordia Health Centre Urgent Care during the same period the previous year. Protocols are in place at Victoria General Hospital to stabilize and transfer patients to an emergency department if they present with an emergency. And Pathways are in place to admit patients to a subacute medicine unit from the urgent care if needed. New staff rotations were put in place to match the patient volumes of an urgent care center. This saw 5 nurses transfer to other emergency departments within the region, while the rest of the staff remained at the urgent care center. The lessons learned from this change will be helpful when Seven Oaks General Hospital Emergency Department transitions to an urgent care center during the region's Phase 2 clinical consolidation. To get a nurse's perspective on the change, click on the link to read more. Another example of transformation success within the Winnipeg Regional Health Authority may be found within the region's long-term care and home care programs. As the region pursued opportunities to provide more care in the community and to keep patients closer to home, 65 transitional care beds were opened at the River Ridge 2 facility in October 2017. Shortly thereafter, Home Care initiated both Priority Home and Rapid Response Nursing Services. Priority Home provides intensive home care services for clients up to 3 months. Rapid Response Nursing provides enhanced home care nursing services for clients with complex medical conditions who require support for chronic disease management. The goal is to promote independence for clients to manage their chronic diseases and to prevent hospitalization or presentation to the emergency department. There have been many positive outcomes. The number of people in hospital waiting for access to a personal care home bed has decreased by 85%, from an average of 81 to 12 at any one time. The number of people living in the community while waiting for access to a personal care home has also improved significantly, decreasing by 53% from an average of 235 to 110 at any given time. The Winnipeg Regional Health Authority has also found a significant portion of transitional care patients, 20 to 30%, are moving back to the community, either going home with the support of home care or relocating to supportive housing. Between November 2017 and June 2018, 164 clients received care through Priority Home. 146 clients, or 89% of these people, were discharged from hospital with these enhanced services rather than waiting in hospital for access to a personal care home bed. The remaining 18 clients were referred to Priority Home services from Community Home Care. These clients were able to remain in their homes as a result, avoiding hospital admission or personal care home placement. Rapid Response Nursing received 247 referrals between November 2017 and June 2018. To read about a personal Priority Home story, visit the link. With the benefit of many expert reviews and reports, individual health organizations have been working on improvements within their own organizations. These efforts came before specific transformation program initiatives. For example, the Addictions Foundation of Manitoba undertook a full budget analysis and assessment of client needs in February 2018. AFM recognized the increasing need for addiction services in specific areas, particularly in women's residential services, and rapid access to addiction medicine clinics where clients can be transitioned quickly from emergency, hospital, or crisis settings into outreach services with a medical component. The Addictions Foundation of Manitoba undertook a full analysis of the 2018-19 budget, including a focus on staffing costs, the use of casual staff, as well as owned and leased properties. Using decision support software, AFM also analyzed the roles, functions, and associated activities across all programs in relation to program outcomes. As a result of this review, AFM put a number of new processes in place, including aligning program roles and functions with program outcomes, establishing an executive review committee for posting of all vacant positions, and aligning the use of casual staff with leading practices and established criteria. With these changes, AFM has already been able to reallocate funds from administrative to priority clinical positions, enabling clients to get into treatment more quickly. AFM continues to review opportunities to save money on leased and owned properties that may then be reinvested in new services. Considering all of these transformative changes from an overall program perspective, Opportunities for savings exist for approximately $64 million per year just from the back office and business surface restructuring and efficiencies. This is shown by the orange, gold, and green colors on the graph. This restructuring will take place during the first year of the health system transformation program. The budget for Manitoba's health system continues to grow, but at a more sustainable rate. Savings found through efficiencies will help flatten the rate of cost increases across the system while allowing us to provide the services Manitobans need. The Clinical and Preventive Services Plan will span a 5-year initial time frame. As initiatives are finalized and approved, they will be implemented over time. It will take time for the cost savings to be realized through this workstream. You can see this in the purple curve on the graph. Our focus is on getting the plan right and ensuring it will be able to achieve the outcomes we expect, both in terms of the financial sustainability of the system and on our central goal of improving the services we deliver. By the end of these transformation activities, it is anticipated we will be able to identify more than $160 million in annual cost savings. Not only will this create sustainability for our future, it provides us with the resources we need to reinvest in priority services for Manitobans. In addition to the financial benefits, Manitobans will be able to see the clear improvements in the quality of healthcare, including improved access to critical health services, consistent standards of health services across the province, improved integration of health services across the continuum of care, and shorter wait times with more reliable and equitable services. Health system transformation is motivated by the broadly recognized need to improve the outcomes, access, and sustainability of health services across Manitoba. The transformation will take a deliberate, sequenced, and integrated approach to creating a better health system. This includes introducing Manitoba's first clinical and preventive services plan, paving the way for clear and more simple access to care, more consistent standards of care across the province, and more integration across the continuum of care, reducing overall complexity and improving organizational accountability in the delivery of care, realigning administrative and support functions, and providing the opportunity for accrued savings to be invested in priority frontline services. Throughout the transformation, our central focus must remain on the delivery of healthcare each and every day. Staff should continue focusing on their daily activities. The success of these changes needs the expertise offered by the highly skilled healthcare professionals throughout the province. You may therefore be asked by your manager to participate in transformation activities. Please visit the Health System Transformation website for more information about the various initiatives. If upcoming changes will affect you and your department, you will be informed directly about the changes. If you have questions, please contact your manager, director, or executive team member first, or email the Transformation Management Office.